if I can get you.
All right, let's start again. Good morning, everyone. My name is Lee. I'm here from Aging Advantage. Today, we're going to be presenting another one of our caregiver education series brought to you by Linda from Continuum. We are happy to have her as she shares a little bit more about Medicare and some of the never-ending changes that they always have for us. We are able to bring these presentations to you through a grant with SLAAA, as they are hoping to educate caregivers of people with dementia as well as disabled persons. With that, Linda, I will pass it off to you.
All right, thank you, Aging Advantage, for offering these wonderful presentations and this opportunity to reach such a diverse audience. So thank you so much for that. My name is Linda Priaulx, and I work for Continuum, which is a non-medical provider of caregivers that come into the home to help folks be as independent as possible and to age in place. And we've been doing that for over 20 plus years. And my role has always been that of outreach and educating families and clients themselves, as well as health professionals, on what is available to help people age in place at home. And I also have a podcast that I started. So if you're a podcast listener, please look me up. The name of my podcast is Aging in Place Strategies and Answers. And on that podcast, you're going to learn what aging in place is and the professionals that you need to get in touch with so that you can be successful, but also to know a little bit more about the healthcare system, because even if you're a professional in healthcare, it's not easy to navigate. And so I don't want anybody to get hung up somewhere along the line. So thank you again for letting me be here, and I look forward to talking with you. So let me get that up there. Right now I could see, sorry. We have the people who are participating in my line of sight, so I can't see my all of my PowerPoint. But again, we're going to be talking about a Medicare program that launched as of July 2024. And Medicare launched this program, a 10-year program, because they realized that those who had a dementia diagnosis and their care partners were not getting the best care experience. And that is not saying that somebody was doing something wrong, but just like a chronic condition like heart disease or diabetes, dementia is specialized. And so Medicare is recognizing that, and Guide was set up to guide people into a better care experience and support the caregivers. And you're going to see some reasons how we got here and a little bit more about what this program means. So if you don't remember anything about what I said today, just remember that Medicare has a new program for those with dementia and their care partners called Guide. All right. So a little bit more about Continuum and how we were asked to join in on this program. And for over 20 years, we have been providing care in people's homes. So whatever the situation was, whether it was a hospitalization, whether it was a return from rehab, whether it was a short-term healthcare episode, or their journey in aging found them needing more assistance rather than less, this is how we've been able to help people in St. Louis City County and also St. Charles County. And what we do is that we offer an assessment in the home to see where the struggles are. What's going on? What problem are you trying to solve? And can our services help support you at this time? Those services can be short-term, they can be long-term, but we also call them respite care. And a lot of folks that have dementia, their care partners need a break, and that's what we call respite. So a break is really respite care. And so this is one way that we have met people with dementia and provided care in the home so that the full-time caregiver, unpaid, can then go to the doctor, go to the bank, go to the grocery store, or take a little bit of time away. And on that slide, you can see some of the tasks that we help with, such as dressing, grooming, bathing. We can help prepare meals. We can help people to remember to take their medications. We can become a companion. We can offer transportation, and also with mobility, incontinence, and other household tasks. Another form of respite services that we provide under our family of services is called adult day programming. And our adult day program is the only adult day program in the central corridor of St. Louis. So we are right at 270 in Manchester. We are smack dab in the middle, right there at Manchester and 270. And unique to Family Partners Home, or Adult Day, excuse me, is that we are really focused on the person with dementia. Other programs also include those with developmental disabilities, but we are really focused on the adult with dementia and how to support them Monday through Friday, 8 to 5, so that the unpaid caregiver can get a respite break. So again, I use that term, respite. So yes, it is about the unpaid caregiver getting a break, but it's also very, very important for the person who has dementia to have the right kind of stimulation. And so when folks come to our home, and we recommend 2 days a week, they are able to be in a safe place, a welcoming place, where they can be as independent as possible, socially active and supervised, but they can also receive the support they need if they need extra support in the bathroom. So we also provide cognitive stimulation therapy all day long to the folks that are attending the day program, and we have actually seen wonderful results. So private duty home care services and adult day services are all part of the guide respite portion. And that's how we were asked to join Empower Me. They are going to be providing the medical piece that's available under guide. And that is in addition to any other Medicare services you're currently receiving. And then to support the unpaid caregiver, we are now able to, through Medicare, provide respite services that are paid through Medicare. So we're really excited about that. And you can see that we offer high-level care management services when we're coordinating care, working with long-term care insurance, or needing a medical power of attorney who can stand in the gap for you. And then as a result of our years of experience providing dementia care, we also have high-touch, small homes that are also located in Manchester, Missouri. So that's high level, a little bit about how this program came together. And while we're a local provider, we have grown the respite services to be nationwide, like all of the medical services that our host partner, Empower Me, also provides. So we're going to go to the next screen and take a little bit deeper dive into guide and how we got here. Okay. So we know when we have our loved one and they're not well and we don't know what to do with them because we're not nurses, we're not doctors, we're not specialty providers, we are going to bring them to a medical community, such as a hospital, an urgent care, maybe even an emergency room. In fact, when you call doctors' offices, they'll say that this is a medical emergency. Please go to the emergency room. And this has caused a lot of folks with dementia to be seen in the medical system, a high usage and not really maybe the proper place for someone with dementia to be seen for the problem that they are exhibiting. Okay, so that is one piece. The other piece is that the caregiver who's providing care for the person with dementia, due to their increased responsibility and this 24/7 scenario that we have when someone has dementia, can lead to caregiver burnout. So if you're a caregiver listening today, I just want to encourage you that you are not alone and that we understand and recognize caregiver burnout, and it is real. So I want to validate you. I want to validate your feelings. And we want to be able to support through guide how the caregiver is navigating the healthcare system and providing care for the person that they are helping. And we find that those with dementia, again, through no judgment or other reasons, that we find that those with dementia can be underserved and provide the lack of support to be successful. So these are some of the reasons why Guide has been offered as a 10-year program through Medicare so that they can gather statistics and come to some conclusions about how supporting the caregiver and supporting the person with dementia with the right supports can really improve their dementia journey and experience. So in July 2024, we rolled out with our partner, Empower Me. In July of 2025, there will be 300 additional agencies nationwide that will roll out in this program, because the expectation is that we're going to be able to serve a lot of people. We're not just going to serve one, we're not going to serve five, we're going to be able to serve hundreds and hundreds and hundreds of folks. So that's why the program is going to expand in 2025. It gave those that rolled out early the chance to see what this is like and to feed data back to Medicare. And these agencies that have been chosen have all the components. And that's what we're going to talk through next. What are the components of Guide? And I've already mentioned them, but there are medical services, there are assessments, there are monthly care phone calls, and then there's the respite portion. So that's why we needed to grow our operation nationwide. So if you know somebody who's not in St. Louis, Missouri, that's okay. They can still enter our portal, and I'll show you how to get to that later in the conversation. So I've pretty much explained where we fit in this. We're partnered with Empower Me, and we are the respite provider in the community. And again, I said that this is a 10-year program. So I'm going to give you an overview of Guide here. And this program was created to support people living at home with dementia. So that's a lot of people. We know that. And those numbers are just going to continue to grow. So what is Guide? Guide allows people with dementia to remain, and keyword, safely in their homes longer, and improves their quality of life. So not everybody is going to admit to a higher level of care. There are plenty of folks that combine services that allow them to stay at home with their unpaid caregiver, but other support services might be coming in or taking some of the load off, such as an adult day program. There is going to be a standardized set of services, which we've already started talking about, for beneficiaries, which is a Medicare beneficiary, somebody who is on Medicare. But as we're going to see, it's for somebody who's on traditional Medicare. So I'll explain more about that. And this Guide program is going to use an interdisciplinary care team to deliver services. All right. So that means that there's not one thing that's going to support the person with dementia. There are several things, and that's what an interdisciplinary team does. So how does this work? Well, in order to participate in Guide, you must be aligned to a Guide provider, and Continuum is one of those providers. So let's say your doctor we think of your doctor being a Medicare provider, but they are not a guide provider. So you would need to enter our portal or one of the other folks that is coming online with the guide program. Very important. Now, an individual who does show signs of memory loss and their caregiver must complete a comprehensive assessment that is then submitted to Medicare. So, what is going to happen is that we're going to be making sure that you are a Medicare beneficiary and that you are aligned with a provider like Continuum. And then we will call to schedule assessments. And there will be some key things that we're looking for in there. But before I talk about that, I want to talk about who's eligible. So those that are eligible for guide is an individual with or without a dementia diagnosis. It is somebody who is a traditional Medicare beneficiary and not a Medicare Advantage beneficiary. All right. So this is a Medicare program. It's not a private insurance program like Medicare Advantage. This program is no cost. And this program is not available to those who are already living in a long-term nursing home or on hospice because you already have an interdisciplinary care team. But you can be dual eligible and have Medicaid and Medicare, Medicaid, and VA and guide. All right. So we can link things together for you, but those are the criteria. So a comprehensive assessment is done in the home once we determine that, yes, you are a traditional Medicare recipient. And we are going to be doing very specific assessments to determine where the person with dementia is in their journey. And then also to assess for the caregiver burden. Because remember, this program is for both. It's for the person who has dementia, and it is also for their care partner. Part of this program is the medical health piece. And I want you to understand that this medical health piece is in addition to any other Medicare services that you're currently receiving. This is not instead of, this is in addition to. So remember the slide that said underserved and limited access? Well, now we have the capability to have 24/7 telehealth accessibility and then 125 plus specialty providers. So I just want to share quickly one of the success stories that I heard the other day from our partner Empower Me, who is providing this part of the guide program. And they had a gentleman who was exhibiting some behaviors related to the dementia. And so the unpaid care partner, the person with dementia, and the specialty provider, which was the geropsych doctor, all were able to get on a virtual call, understand behaviors, understand what meds were currently prescribed, and then discuss what might be beneficial. All right. So that's a success story. Instead of having to go to the emergency room and sit there all day and then have somebody do all those assessments to figure out, can we solve these behaviors? Are we equipped to do that? This was solved at home and easily done. So thankful to our partner Empower Me, who just shares success stories so that I can share them with you. So as I said before, and I've been a caregiver, and I'm not a nurse, and I'm not a doctor, and I'm not a specialist, and I know things. But if I don't know what to do with my loved one, my first thought is I need to get help. And that help is more likely going to be of an emergent nature. Otherwise, I'm going to call a doctor's office and we'll handle it during the week. But this allows for these after hours and for these specialty providers because many people who work in our field of healthcare and specifically with those with dementia understand how hard it is to get a geropsych referral. how hard it is to get a neurology appointment to determine dementia. So this just makes it easy and provides for easier access. I want you to take a moment and really allow that number uh, to sink into your mind so that you remember this as well. That guide pays the caregiver, the unpaid caregiver, the person who needs a break, who may have a trip coming up, may need some caregiving. Medicare in under the guide program is actually paying respite providers like Continuum and our partners $2,500 to provide respite care to caregivers who have demonstrated a need and will get this much needed break. Okay. This amount of money is annual. It is not a one-time, once in 10-year benefit. It is annual and it renews in July. So if you think about coming into the program now, as of April, you know that you have $2,500 in respite benefits to use, and you would have them renew in July. So that is huge. And if I break that up into what Medicare is actually paying the provider, then you know that's about 80 hours of private duty care. You know, that's about 24 visits to the adult day program. And then if you were going to do a short-term stay in a long-term care community. Now, remember, you're not a resident. You're just going for a break and for a respite. And we currently have a participant in Guide, and his wife knows that with his level of dementia, he's going to need a 24/7 respite. And so then that will allow her to go to an event that she would like to go to. And then she will return refreshed, but that will allow for several days, about 8 days in a community for a respite. So how much money are you going to be given? Actually, you have to use a provider that's already in the system, and then we pay that provider for that care. So it can be done at home, it can be done in an adult day program, or in a 24/7 respite community. The check-in phone calls are a huge part of supporting the family caregiver or the unpaid caregiver or the adult children who are providing much needed companionship. And so if you hear me say unpaid caregiver, that's who I'm really talking about. And that unpaid caregiver could be a spouse, it could be a son, it could be a daughter, it could be a power of attorney. And so that is what this care navigation is for, is what problems or what is your experience like today when we're calling, or this month, and what do you need? How can we help? And so some of that might be in caregiver training. One example I like to use is that of sundowning. You know, we just had daylight savings time and that change. And sometimes that can really throw schedules off. And especially for those with dementia, sundowning can be a problem. Now, maybe your loved one has never had sundowning, and maybe they never will. But on a care navigation check-in phone call that's going to be happening one time a month, the caregiver, the unpaid caregiver, may say, well, everything's been going well, but whoa, now I feel like my loved ones get really jittery, even more confused at night, very restless, unsure, rubbing their legs, wringing their hands. And we might say, well, that sounds a little bit like sundowning. So how about if I send you, how about we talk about some ideas that you could utilize, and I'll send you some training on that. Maybe things have been really smooth, not bad at all. But another month, you might have been in the hospital a couple times. Well, what's going on? Has it been there a decline? Is it time to talk about a resource that might be appropriate for palliative care or maybe even hospice? How can we help you with the referrals that you need so that you can spend your time helping your person with dementia and allow us to do the care navigation and look for those referrals and those resources? And then, of course, how can we help connect you with the 24/7 medical services that are available to you? So reminders that you do have that access to specialty providers, that you do have that telehealth capability, and that we can get answers sooner rather than later so that you feel supported and not frustrated in a medical situation. So here are some benefits of guide that can and what Medicare is trying to see as progress in helping people have a better uh, dementia experience. All of us are changing. We're learning more about Guide every day. Every agency that's involved in this, every partner that's involved in this is allowing our agency to grow and to expand and to implement new delivery care models that really meet the needs of those with dementia and their unpaid caregivers. And of course, it is reducing disparities for those who have dementia, because it really is a specialty to be able to provide care, to be able to provide respite services, to be able to provide medical services. Because now you have a portal that you can enter that is going to be an interdisciplinary team, and you're going to feel that wraparound support. We can provide more coordinated and comprehensive care so that the patient is going to have a better outcome, and that we can reduce the caregiver's burden. And the end goal is to keep that person who is suffering from cognitive decline in their home longer. That's where they're more comfortable. That's where they feel safe. And so that is one of the goals of this program. Not everybody is going to be able to afford a higher level of care. We know that the numbers coming into the healthcare system of those retiring, but also those who will experience cognitive decline as they age, because we've been given longevity. This is going to really burden the healthcare system and the communities that are already built. So not everybody is going to enter a higher level of care. And then, of course, Medicare gets to measure how this is going. So there will be a continuous improvement of services through their performance measures that are focused on both the patient and the caregiver quality of life, which to me sounds wonderful. If you've been in that space or you're currently in that space, to know that by getting data, Medicare is going to be able to measure the performance, and that they're really focused on the patient and the caregiver and improving quality of life. So again, improving quality of life for the person living with dementia, their unpaid caregiver. The burden should be reduced because now you have monthly check-in phone calls. You have 24/7 access to a medical person. And then also you have your $2,500 in respite benefits. And so these things will definitely work to prolong the need for placement. This website right here that I just moved my cursor over, this guidedementiaprogram.com, is an easy way to connect with our portal. It is also you can also call 314-686-4465 and choose I want to learn more about Guide and hit that button. But this portal has a secure referral form. So if there are any professionals listening today or adult children or caregivers, you can go into this portal and enter your information. 24 hours later, we will be contacting you to let you know whether or not it is true, because we all get confused on what kind of insurance we have. If you are a true traditional Medicare beneficiary. So don't feel bad if you don't know. I'd rather you go ahead and use the portal than not. And we will let you know if you are a traditional Medicare, client. And then from that point, we will be calling to schedule a home visit. And the person who's calling will find a time that's convenient for you and the person that you're caring for. And this is where we're going to do those initial assessments. We're going to be screening for cognitive decline. We're going to be screening for depression, for hearing. We're going to be screening and assessing for function, because all of that is important information. And then, of course, we're also going to be asking the caregiver where they are in their role as a caregiver. And, one day it might be going well, and one day it might not be going so well. So those are going to be ongoing questions, but that information that we glean from that visit will then be submitted to Medicare with a care plan that's unique to you, the person and the person who has the dementia diagnosis, so that we're meeting your needs, not our needs, your needs. And then once you are then aligned, they call it an alignment, everything has lined up. And then now everything is at your fingertips. You will know who your care navigator is, and you will be able to get in touch with them. You can send information, email, phone call, 24/7, and then of course triage. And then we will be talking to you, during business hours to help guide you through the process. So we are growing the business and the portal and the platform so that we can have more people enter the guide program and then benefit from this. So I'm just going to stop there and ask if there are any questions from the audience who's been listening today.
Hi, Miss Linda. Well, first of all, I want to say thank you very much. This was some really, really great information. And so I have a couple of questions. The first
Okay.
question is, as a caregiver, when you're taking care of your loved one, do you know or can you give any kind of signs for a person to know when they're either at that burnout state or getting close to it, or at what point should they, if they are approved to go through the guide program, at what point should they then reach out to say, okay, I need some kind of respite care or, some type of help?
That's a great question. So thank you for sharing that. And I think that really helps the folks that are listening. I've been a caregiver and I've experienced caregiver burnout. And then we have 20 plus years of providing services for folks who are navigating health crisis, not just dementia, but when it's dementia, this is my saying, no one should do dementia alone. All right. You have to have a network and a support group. So I would say if dementia is the diagnosis, I think it's a perfect time to start looking around for resources, because we know this can be a degenerative disease. All right. Generally, people do not get 100% better. That's why we're screening very carefully to make sure it is dementia and not depression. Okay. So I would say if you are providing unpaid care for someone who has dementia, that now is the time to start thinking about who is going to be in your resource network. Who are the people? Are they other family members that can give you a break? Who are the specialists? Who are the doctors that are helping you figure out and do some decision making with you? What are you doing as a caregiver to keep your health strong? What kind of coping mechanisms are you putting into place? This is not going to be easier. It's going to be harder as a person progresses through their dementia. So I like to say sooner than later. And I know that when we talk about guide, well, why not Medicare Advantage? But I would just encourage you to call the 800 number on the back of your Medicare Advantage card and ask them if they have care navigators for folks that are going through dementia and their unpaid caregivers. Because I do know other professionals that work for agencies that support Medicare Advantage plans. So it's just knowledge. So for those who are care partners, knowledge is key. So not doing it alone, knowledge and utilizing the programs. I've heard people say, well, that's great for other people, but I'm not going to do it. I don't know why. I don't know why, unless you just want to go
Right, I
down
agree.
hard, you know?
Yeah, I agree 100% with that because everybody needs, even on just a typical job, everyday job, everybody needs a vacation. I know, I've been in workplaces that people have their vacation time built up so many hours where they're made to take off. And I'm like, how can you dare do that? Because everybody needs a break at some point, no matter what. And it does not mean that you don't love your loved one as much as you did, when you were working. It's just that everybody needs that time to step away, regroup, and make sure that they are healthy so that they can be of the correct or the correct and have the correct support that their loved one need. Because if you're no good to yourself, how can you be of such great help or need to someone else? So
Yes.
I
Yeah.
most definitely wholeheartedly agree with you on that. It's
We
great, Linda.
had we had a client who had said, "Oh, we've got 12 people in our family. They are all focused on helping our loved one be successful." And by the time we had the family meeting, I would say there was a handful of 3 people who were willing to do hands-on care for that person who was starting to age in their journey. And they were disappointed by that. And I said, we're all different. And so not everybody's going to be a hands-on caregiver, but somebody could be the best shopper
Right,
and
there you go.
somebody could pay bills. And somebody might like to do transportation, or somebody might like to take someone out for to a restaurant where they're safe and they feel comfortable and they can get in and out of it at a time that it makes it a worthwhile visit. So I say that caregivers move to people's strengths.
Yes.
Who in your support group can I tap to do this? And then let them do it. Everybody says, "What can I do?" And you go, "I don't know." And then you feel bad calling. But what's in their wheelhouse?
Yes.
And once you find that out, well, would you be willing? I know you're a great shopper. Could you just do all the grocery shopping for us so I don't have to think about it? I'll get you the list on Friday. You can do it on your day off Saturday. We'd be most grateful. There's ways to work around things, but as a care provider, partner, unpaid caregiver, we think, well, we are the only ones who know how to do this. I'd have to explain too much or do so much, but there are things that we can let go of. And
Yes.
I think we just have to be smart about it. And that's what I would tell you about Guide is be smart. What are you waiting for?
Yes.
This is you.
Yes.
It's never too early to enter the program. As your loved one progresses in dementia, then you've got the support and they already know you and can
Yes.
get those interventions in place early. We who work in healthcare always say, gosh, if they'd come earlier, they could have had so much more support, right? Do we say that about
Yes,
hospice many
yes, yes,
times? Gosh, if they had
yes.
gotten on hospice sooner, they could have had much more support. We could have been so much more helpful to this family. So
Yes.
that's one of the reasons why I just encourage early interventions.
Okay. And I agree with you on that as well. That helps relieve a lot of stress, because as the disease progresses, sometimes you just, some things you just don't think about, and not thinking about it doesn't make things better. It's really seemed like it makes it worse because no matter what, you still have different things that you have to face and go through, and different things that you're going to need and the type of supports that you're going to need. But I agree, most definitely, Linda, what you guys have is a great uh, program, platform, and I hope many people will take heed and begin to, even if they just write down you guys' information and just, hand it over to a neighbor or somebody. But please,
Yes.
this is something great, and it will be very, very beneficial. Um, Me, myself, I can attest to what you're saying is very correct when it comes to the dynamics of the family of who does what, because I had to experience that about 10 years ago with my father. Well, it wasn't that he had dementia, but he had ended up having a stroke, and that stroke debilitated him in such a way that we just wasn't used to him being down like that. And of course, he wasn't either. But we end up, because I was the one in the medical field, of course, then I had to take on a lot of it. But I was so grateful that my siblings, it's 8 of us. So they came in and said, okay, you're not in this alone. What can I do? So I was a person that helped with anything that came to like the doctors and insurance, and somebody else, like you say, did the grocery shopping. Somebody else did the transportation. Somebody else would just make sure that he, different things that to be the cook, the chef, and it
Yes.
just really, really helped, so that nobody had to, even if somebody couldn't do their job, we would just call on the next person and say, hey, I have this to do myself. Can you do this? And it really helps with the caregiver burnout, because you don't feel so overwhelmed so quickly because you're already mentally going through some things, just watching your loved one, struggle and go through the decline that they have. So this is such an awesome, awesome thing. I have my father-in-law in Georgia. I have your information. I'm going to give it to my sister-in-law to see if it's something that they can take advantage of, because he has been diagnosed with dementia, and he had been on hospice. So that's my next question. He had been on hospice. It's been less than a year ago, but he's been doing phenomenal that they end up taking him off. So in
Right.
his case, is he somebody that could possibly qualify, even though he had been on hospice?
Yes, because, and this is what happens, and this is just Medicare guidelines that when somebody improves, which is part of what hospice does, people think about it the other way, but in many cases, and especially with hospice, dementia, there's a lot of success stories there. And so when they're successful at eliminating some medications and getting this person to a new normal, then they must discharge them off hospice. So this would be a perfect person to say, okay, now you're off hospice, you're doing well, you've flatlined, you're kind of stable. This is great. Why don't we do guide? And then let's say that the care navigator calls 1 month and the care unpaid care partner says, well, we were in the hospital 3 times last month. I really think my loved one's taking another decline. And the question then would be, I heard what you said. Is now a good time to reach back out to the hospice provider? And usually we're saying what the person is thinking, right?
Okay.
Because they're wondering the same thing. Well, they got him off hospice, but we know in healthcare that now might be the best time to have them reevaluated and then get back on those hospice benefits. You would lose the guide program, but that's the whole goal is now you have another interdisciplinary team that will help you and can guide you through the process. So great question, Donna. That's the one I love to give.
Great, great. And thank you for your answer and again for your time today. Is there anyone else that would have any kind of questions or comments, concerns while we have Miss Linda Steer here on line with us? And I can't see if anybody from Facebook would have a question or not, but I'm glad you provided your information. So if they did have a question, they do have a way of being able to get in contact with either you or the program somebody, and that's a great thing. So with that being said, well, Miss Linda, again, thank you very, very much for your time and attention today. It was a great presentation. And I do hope that somebody takes advantage and listen to what you said and be able to take advantage of this.
Absolutely. Just call us or enter that portal, and it's very easy. We can, any question you have, we can answer. So
Great,
don't feel bad. I love questions.
great, great, great. Okay,
Thanks
well,
again for having me.
you are quite welcome anytime. Thank you again for your time. You have a great day.
You too.
Thank you. Bye bye.